We are reporting now from a treatment room, and we're standing in front of what is called a LINAC. Dr. Tarlton, explain to the viewers, what is a LINAC? What does it do? What does it treat?
Sure. Well, here at CurePoint, we actually have two linear accelerators. So LINAC is just a term coined for linear accelerator. And this particular unit allows us the capability of doing what's called IMRT, or intensity modulated radiation therapy. And by that, we're allowed to focus the fields very accurately around the tumor and spare normal tissue as much as possible. And 20 years ago, say, we didn't have this kind of capability. We had to use lead blocks that were mounted underneath the treatment beam. We treated a lot of normal tissue that we didn't need to do, and couldn't go to as high doses. But now, within the head part of this machine, there are actually little leaflets that will move during the course of the treatment, and they will shield out normal tissue. We use what's called static IMRT rather than dynamic IMRT, but the net result is that we can give a much more focused dose of radiation and spare normal tissue.
Very good. So the patient's arrangement, or their orientation while they're on the table, they lay obviously with their head here.
Right, and their feet here, although it can vary depending on what part of the body we're needing to treat. They're immobilized with a variety of different devices to keep them in the same position, obviously, when we treat them each day. And then this machine will rotate around, and it can rotate 360 degrees all the way around the patient. So there's no movement involved on the patient's part. There's really no pain or discomfort involved when you get radiation therapy. People have their treatment and get up and go on their way. There's no immediate side effects from it.
Very good. That was going to be my next question. What can patients expect if they were to come and have a linear accelerator type procedure done?
Sure.
It's not painful. They can go home immediately, drive themselves home.
Of course. Yeah, of course. And the side effects of radiation treatment just depends on the area that we're treating. So there would be no hair loss, for example, unless we were treating a patient's brain or scalp. But otherwise, there would be no hair loss. And all the side effects really depend on the area that we're treating. So
now, I've heard this referred to in the past as surgery without a knife. Is that essentially how the linear accelerator works?
Yeah. Well, what you're referring to is what we call stereotactic radiosurgery.
Okay.
And what that involves, that's using a linear accelerator, or sometimes another machine that's called a gamma knife, which is just an array of cobalt sources, which allows, again, the tumor to be pinpointed, and a very high dose of radiation, much higher than we do with conventional IMRT, is given over a much shorter setting. Now, that's what's called stereotactic radiation, and that can be used. It's got excellent use for brain tumors, child tumors, pediatric tumors, and more recently it's been used for other body parts, for example, liver metastases, lung tumors. The advantage to that treatment is a very high dose is given over one or say up to 5 treatments, so that minimizes the overall treatment time. It's got a great track record in brain tumors, not as long a track record in other body parts. And immobilization is key. It's easy to immobilize the head because we can put a big stereotactic frame on a person,
right.
But it's a little harder when you're talking about lung because you're breathing, obviously, and
right.
Other body parts, it's more hard to immobilize.
The linear accelerator can do more treatments.
Right.
It requires more treatments, but it's more generally able to treat cancers throughout various parts of the body.
Right. And an added feature that we have is a way to verify that we're treating the area we set out to treat accurately each day, because obviously there's issues of patient motion, and the device that we use is what's called a brain lab. And depending on where we're treating in the body, we can either use internally placed markers or skin markers to verify that we're setting up correctly on the patient each day. And each and every time a patient has a treatment, we verify that we're right on the target, basically.
And if the viewers hadn't heard, the linear accelerator has taken on a life of its own. Yes. The motor is running now. So I'm going to hand the mic over to Gina to explain Brain Lab and what all it entails.
Hi. The Brain Lab has a camera up here where we load the little body markers on the patients. We also do that when we scan them. So it picks up the body markers. Then we take x-rays each day, 2 of them. One, that's an x-ray tube over there on the floor, and there's one over here. They come up and hit the intensifiers, and it gives us an image which is then fused over the DRRs, the digital radiographs that we get from our CT scans, and then it gives us shifts so we can move the patients to exactly within 1 to 2 millimeters of where we need to treat them. So it's a very accurate way to treat the patients.
Just to amplify what Gina has already told us, it's very important to verify that the patients are in the same treatment position each and every time they get treated. Otherwise, we can't use narrow margins to treat them.
And it's important to localize the beams because we don't want to kill any non-infected tissue or organs. So,
and what's important is that this is done, each and every time before patients get treated. So there's no risk that another part of their body can be accidentally radiated. So it's very accurate.
Explain to me the differences between radiation therapy, or what the linear accelerator can do, versus chemotherapy.
Well, that's a big question, but chemotherapy involves radiation therapy is just high energy ionizing radiation rays that will pass through that part of the body. Presumably, they kill a certain number of cells that are dividing at that point in time, reduce the number of cancer cells. Normal tissue can repair and regenerate over 24 hours, whereas tumor cells lose their ability to replicate. Whereas chemotherapy or cytotoxic drug therapy travels throughout the bloodstream, killing tumor cells as they're in the bloodstream or within an organ of interest. So chemotherapy is a more general treatment, I suppose, than radiation therapy, which is just focused on the particular tumor.
Very good. So Gina explained to us the markers. Let's actually take a look at what we see on the computer.
So as we've already discussed, we can put surface body markers on a patient to determine the correct positioning of the radiation field, but in some cases we can actually implant permanent markers into the organ at risk. In particular, prostate is the best example, and that will allow us to focus on the prostate. Now, we do place gold fiducial markers into men's prostates here. We use ultrasound guided technique. It's relatively pain-free. We do them many times a week, and they don't have many problems with it. But these are permanent markers. They're not radioactive. But as you can see in this particular patient, where we've implanted the little marker seeds, which you can see, we typically put in 3 or 4. And then when they first had this patient lie on the table, because of just the way he was lying, these what we want to do is line up these green marks to where we know the prostate is. These are in the prostate. So we apply the shift, and lo and behold, the green marks are now on top of the implanted seeds, and we know that we're right on the prostate. So we can treat this area with a very small margin, and we're talking like 5 to 8 millimeter margin, which is the way you want to do it. And that's done each and every day before any patient gets treated, basically.
So, Dr. Tarlton, that's the imagery that the linear accelerator can provide. I know another technology available to patients here in the community is PET scan.
Oh, yeah, and we certainly I'm a big fan of PET scans, and we certainly use them for many, many patients, both in their initial diagnosis to rule out other areas of disease, and in follow-up. But for the radiation oncologist, PET scans are very important because they help us to accurately delineate the tumor, which up until a PET scan has been kind of difficult just using a diagnostic CT scan. It's hard to tell what's scar tissue, what's normal. But a PET scan, as you know, shows hypermetabolic activity, which you'd only see with a tumor or with an infection. So it helps us a great deal to have a PET scan before we start treating.
Can we take a look at some of the imagery?
Sure.
So Dr. Tarlton, explain to us what we're seeing here. What body parts are we actually seeing on this imagery?
Sure. Well, just to back step, when any patient is starting on radiation treatment, we do what's called a radiation treatment planning CT scan, which isn't of the same caliber as a diagnostic CT scan, but we have them often in different positions to help with their treatment. But what this is a really nice piece of software. This is made by Velocity, and what it allows us to do is to fuse the images that we get on our CT scan with any diagnostic scan the patient has had on the outside. This happens to be a PET scan. This patient actually had it at Fairview Park, but we can also fuse MRIs, diagnostic CT scans, pretty well from anywhere, because this particular piece of software allows us to do that. And that's really, really important because it's very hard to tell from a CT scan what's active tumor and nodes and things like that. And this is the chest, and the bright area in the center part is the PET avid area, so we know that's tumor. And this is these are patient's lungs. This is his vertebral body.
Is
this
the
is his
tumor
sternum.
always red?
Yeah, it's much brighter.
Okay.
It depends, again, what screen you have on to the color it is, but it's bright, much brighter than what the normal tissue is around it. And the heart, of course, often looks a little bit brighter. Bone marrow can look a little bright if they've had chemotherapy.
Okay.
That's common. That I'm not worried about. But this helps us to identify what nodes are positive. And you can see just looking at that, if you didn't have those little bright spots, you'd be hard pressed to say, oh, that's an active node and that's not. And so that allows us to, again, ensure that we're treating tumor, not normal tissue, and also gives us a way to monitor how successful we are. So I'm just scanning now through his abdomen. That's his liver, and we're getting into his intestine and whatnot.
So it looks like we're moving from the head
right, we're
down.
downward, right.
Okay.
But the area we're interested in was that bright area, which is where this particular patient's tumor is sitting in his chest. And that's a really good tool to have.
Quite amazing technology, and it's indicative of what we have and what we can provide right here in Dublin.